Hey Chris, it's Ron. How you doing today?
Hi, Ron. Doing great. Looking forward to diving into this. Today, we're going to be going over the 12-step HIPAA compliance website checklist. Now, for those of you who are taking a look at this, we really want this to be actionable for you. We've broken it into each of the steps so you can jump ahead if you want and just kind of dive into relevant areas of this checklist. We're going to start by giving a high-level overview and then dive right in. So with that, Ron, I'll turn it over to you to kind of give us an overview.
Yeah, that sounds great. So I think everybody understands and has at least heard of HIPAA, right? But there are so many elements of HIPAA that they don't understand. I mean, first, people sometimes say, well, the HIPAA compliance, and then they say HIPAA rules, and then they say HIPAA guidelines, and the HIPAA entities and the covered entities. There are so many different acronyms and terms and things regarding HIPAA. And I know that you've done a number of HIPAA videos recently, and you've even gone in and done some HIPAA in the news where you're going out and looking at the government site and showing just the sheer numbers of businesses that have been found to be in HIPAA violation and some of the fines and some of the things that have happened. So today, what we really want to do is first off, just say, failing to invest in HIPAA when you are dealing with PHI, protected health information, can result in substantial fines. And you have to figure out how to make your site HIPAA. How do you do that? Well, if you don't know, then you need to get with a vendor, someone similar to Clarity, that deals with this day in and day out. We've done this for 16 years. We've literally done hundreds of sites for medical. It's our largest single industry that we work with. We do a lot of e-commerce and a lot of other things, but our biggest single vertical is medical. I mean, medical portals, medical apps, online pharmacies. HIPAA compliance is our specialty. So one of the things we want to do today is really dive in and start talking about that. The first thing we're going to talk about is, what is your responsibility? So Chris, I want you to go ahead and define what is another one of the words and terms that they use is duty of care, right? So I want you to define what the duty of care for HIPAA compliance is, and then let's just start diving into the list. We'll talk about covered entities next, and then we'll dive right into the list.
Absolutely. Thanks, Ron. Yeah, so this is pretty interesting. So generally speaking, the concept of HIPAA really started in 96 whenever essentially the privacy rule was established in the original version of HIPAA. And then there have been iterations that have included actual legislation that passed that modified it, such as the security rule that came out and the omnibus rule. And then there have also been notifications that have adjusted really how you should see the OCR, the Office of Civil Rights, and the HHS. And these are essentially the enforcing body for HIPAA. And fundamentally, what you find is that the concept of HIPAA is, as you said earlier, Ron, it's related to PHI data, and it's specifically, a covered entity. And so this is someone who's essentially providing healthcare. Whenever you're providing healthcare, the original intent of HIPAA around 96 was really focused around medical information for healthcare coverage and insurance, essentially. So being able to deal with insurance and transferring that insurance data. And that was really the original scope and concept of it. And then it really evolved with the internet and with a lot of kind of digital transmission of the data through networks and offices and databases and those kind of things. So now it really depends on your scenario, but effectively you want to think of it as whenever you are working with a patient in a healthcare type of environment, and there's information that is identifiable to them, that is medical information, that's typically going to be PHI. And depending on how you're handling that, if it's available or possible to get access to it, publicly somehow in a digital form specifically. So if you're storing it on a database or sending it over a network and you're somehow saving it or storing it or putting it somewhere, then that information is most likely, that is the PHI, that is going to be governed by HIPAA. And if it's transient and it's not being stored, there are some potential edge cases there. But you really want to be able to understand the HIPAA rules specifically the privacy and the security rule, and how those work and how those apply to you if you are dealing with that kind of information. So, Ron, I'm going to turn it back over to you to kind of cover any points here that I may have missed. But that's just generally the concept, is that PHI data that's part of interacting with patients and what the responsibilities are for keeping that secure and keeping it private.
Yeah. And for a lot of people, it's very confusing because they're like, well, I don't know if I define me as a provider. I mean, I'm a counselor, or, I'm a occupational therapist. I just go to their house and help them with their physical therapy. So you have to think about it. The way I like to think about it is money, right? You and I start our bank, and it's Ron and Chris's bank, and people give us money. If you think about the money as the protected healthcare information, if Chris was a client of mine at my bank and Chris walked up, Chris could go over to Barbara and hand her $20 of his money. He has the right to do it. It's his money, right? It's his protected information. If Chris had, I don't know, make up some disease, right? If he had a disease, he could walk over to Barbara and go, hey, I'm sorry, I can't come within 6 feet. I have this disease, whatever. He has that right. But if I have his money, I don't have the right, without express written consent under specific guidelines, I don't have the right to take Chris's money, walk over to Barbara and hand her $20 for Chris without permission. So if you think about it kind of like money, you're holding people's, their data is money, and you're holding that money and you're responsible. And that's your duty of care, is to protect that information. So now banks go and pay money. They pay loans. They do stuff with that. So how do they do that? And that's where the HIPAA guidelines start coming in. So if a doctor has information about Chris, and that doctor goes and recommends Chris to a specialist and has to share Chris's x-rays and Chris's lab results with that specialist, he is now sharing protected health information outside of his purview, handing it to someone else. And that's where the guidelines come in and go and start expressing all these rules of how do you protect the data as you're sharing that data with other entities outside of your purview. And that's where HIPAA starts really coming in, and the guidelines of how all of these people have to protect that data. I don't know if that helps anybody at all, but I know that sometimes I don't know if HIPAA applies to us or not. It's better to say it probably does. Get someone like a Clarity, get on the phone with them and just talk about it for free, and just go, hey, can I consult with you to figure out if these even apply to me? I want to make sure I don't do something dumb and put my business at risk. That's probably the best start.
Yeah, just another side note on that too. On the hhs.gov website, and we have a YouTube video that we can link to on this, but on the HHS website, there is literally a guide that you can go through the question and answer on. And we can put a link to that guide as well, where you can literally just go answer the questions. It's like a wizard that you can go step by step to see if what you're doing needs to be HIPAA compliant. So that's a really helpful guide as well, just direct from the government.
Well, that works too, and is from the horse's mouth. So maybe going straight to that list first and filling that out's the best thing. And then maybe the time you pick up the phone and call the vendors to find out, how do we do this now that we know it does apply to us? So that's a good thing. So here is the term Chris used earlier was covered entities. And the covered entities is who does the HIPAA rules and who does the guidance apply to? And this is just a quick list, right? It's basically your doctors, your pharmacies, the nursing healthcare. And when you say doctors, it's kind of like doctors and counselors and providers and physical therapists. It's all of those that fall under the healthcare provider role, if you will. Nursing homes, other companies, organizations, and any individuals that would transfer medical information. Well, insurance companies aren't under doctors, pharmacies, and that, but they transfer medical information, so they fall under the same thing. Because when you're doing healthcare insurance policies, prescriptions, Medicare, Medicaid, all the different things that deal with our information and our prescriptions and the diagnoses we may have, that falls under it as well. So let's go ahead and dive in, and we'll just kind of look. This is the list. So if you kind of want to have an overview of what the list looks like, we've kind of covered it here. And so I'm not going to read down through these because each of the subsequent slides, we're actually going to dive into each one. So let's just go ahead and dive right in. And let's cover the first one is if you're going to build a portal. Now, a portal could be a website. A portal could be an online pharmacy. It could be a doctor-patient portal. It could be a mobile app. All of those things kind of fall under this rule that we're talking about here. So if we're going to create this HIPAA compliance checklist, we want to start talking about what that checklist does. So Chris, I'm going to turn it back over to you, and let's go ahead and start talking about step number one, which is creating the specific checklist. And let's start the overview there.
Yeah, thanks, Ron. So one of the things that I'll say just in general about HIPAA is if you visit the HHS website and take a look at their summaries, they have some excellent resources that will fill in a lot of these details that we're talking about. And we really want you to see what we're doing as just pointing to those resources that are the source of truth. The other thing that I'll say about this checklist piece is I couldn't agree more. Making a plan essentially for how you're going to be compliant with HIPAA is absolutely critical. It's just a fundamental as a human being and as an organization to be able to put a plan in place. One of the best things you can do is leverage some of the resources on the Clarity site. We have this checklist. We have a checklist that you can use and you can download, and it's complimentary. Happy for you to benefit from it and utilize it. So one of the things that you're going to want to do is consider how we can modify the checklist to be specific to your scenario. There's also a general, just again, quite detailed set of vendors who run audits as their entire business. They run HIPAA compliance audits as their entire business model that we work with and we partner with. Who we can collaborate with and help you to get access to. We will list several of those here in the description so you can take a look at their websites. But depending on the level of detail you want to go into with this HIPAA compliance website checklist, you can download our complimentary checklist. You can access basically the automated testing that's available with some of these HIPAA compliance tools and vendors. And then you can also access the government. Literally, the government has several free compliance auditing tools that you can download from them. So generally speaking, Ron, there's going to be a specific kind of configuration that each website will have. If it's a very simple website and it's a very simple implementation, we recommend starting with the checklist that we have on our site. It's really, concise and to the point. If you're doing something more complex, you eventually want to move toward one of the auditing tools that we mentioned. And ultimately you need to have if you're complying with HIPAA, you need to have a compliance plan. And so what that means is you're going through the specific questions that the government recommends on their website. And again, they have free compliance auditing tools, which is awesome, that you can download and use. And you can work with a third-party vendor like Clarity, and we will help you to execute on those audits and implement those audits, or you can conduct those yourself. But that would be a high-level summary, is that we have a really nice checklist that you guys can download and take a look at. Just some of the high-level concepts from that checklist. They're going to include security. So think of industry best practices, being able to make sure that the site itself and the hosting meets baseline security standards. And without going into a ton of detail, the data itself needs to be encrypted at rest and in transit. And there needs to be a way to ensure that the actual interaction with the data is tracked. So only users that should have access to data should be able to access it. Typically, this is going to be role-based authorization. And, generally speaking, any application should tend to have that. You'll also see that, around the privacy side of things, there's a requirement that a lot of folks aren't aware of with HIPAA data, that basically the patient, the one who's receiving the care, they should be able to request removal of their data. And they should also be able to request a download of their data so that they can transfer it to another healthcare provider. And this can be kind of a gotcha for a lot of folks that aren't prepared for that. You just need to have a mechanism for them to make that request. It doesn't necessarily need to be an automated process. So you can respond, let them know you received their request, and then complete their request in a reasonably timely manner. And these are some of the kind of fundamentals that we see a lot of folks not necessarily getting. Again, really, I think the big thing here, the big takeaway on this is that we have a great guide, a great checklist that you can download from our site, which we've linked here. There are some excellent vendors that we work with that we highly recommend if you want really a concierge type of a process. And then, of course, you can get the free resources on the government website.
Yeah. Yeah. I love how it's like when you say it's adjustable per product, it's like a recipe, right? I mean, if I'm making a recipe for my daughter and her 3 friends, that's going to be a different recipe than if I'm doing it for a church bake sale and I need to do it for 200 people. I got to modify that recipe because there's just in that case, it's a different scale, right? So exactly like that. Well, the second thing down the list is researching the healthcare industry needs. So this now applies specific to your business, specific to your industry, specific to the things that you're doing with the business. This could be different for a counselor, as it could be for a pharmacy, as it could be for a doctor's office. So there are some sites that we've done that are HIPAA compliant that don't have everything that you mentioned, right? We talked about having the data encrypted at rest and the data encrypted at transit. We've got HIPAA compliant sites that don't have the data encrypted at rest. How is that possible? Well, because the site was a simple website for a doctor or a dentist, and all the site did was talk about the doctor's services, and then it had an onboarding form, and the site had an SSL, which encrypted everything on the site. And when the client went to sign up as a new patient, they filled out that form. And when they submitted the form was sent directly or was embedded within a HIPAA compliant forms tool. And so the website didn't store the data. So there was no PHI data at rest on the website. So the website was following HIPAA guidelines and was completely within HIPAA compliancy, although the data was not encrypted at rest, right? So that's when you really start getting into the nuts and bolts of the site. The second bullet here, simple unsecured sites, right? We start talking about different things. That's some of the things. So go ahead and dive into this a little bit and talk about researching the different healthcare industry needs.
Yeah, absolutely. And that's right. And what you're talking about there, Ron, is a really good example, because actually the data was encrypted that was PHI, but anyone who went to the site and looked at the content management system that all of the marketing content was posted to, it would appear that that was hosting that form, and it was not. And so you can do some really smart things with HIPAA where you're essentially separating out the HIPAA data and never letting it touch a, basically insecure environment or less secure. That we would say generally, if you read the security rule in HIPAA, it's not going to meet the standards that security rule has. Now, one of the interesting things about the security rule is if you go into detail and you read it, it literally has a spectrum that they specify is a spectrum. And you are supposed to interpret that based on your specific risk and your perceived risk, as well as the frequency and essentially kind of your expectation of how much exposure your business might have. So you can think of this as like, basically the government is saying, and this is my interpretation, of course, but we don't want to put you out of business, but we want you to be as secure as possible. And we want you to absolutely meet a very high level of security if you're dealing with very sensitive data. So I don't know about you, but if that's not confusing, I don't know what is.
Right.
And so they've done a lot to really provide specific examples and provide a lot of detailed guidance over the years, because that rule, whenever they initially created it, it had to go through a lot of legislation, and there's, I'm sure, a lot of back and forth and, different constituent groups that had to have their needs met, et cetera. And so that's what we have. That's what's written into the law. So it unfortunately is vague, but that keeps it from being so untenable. that no one can meet the requirements. There literally is a spectrum there. The best thing that we can say is that the legislators and the government overall, they are aware of that, and that's why they've done a lot to issue some guidance and resources to try to help alleviate that lack of clarity. What does this mean, though, specifically? Well, depending on your industry and depending on the data that you're capturing as part of your PHI, you really want to be at or above industry best practices and industry standards. Now, the kind of summary for this is going to boil down to us recommending that you end up working with a specialist for HIPAA if you have sensitive data. A lot of people think that their data isn't identifiable, and that's probably one of the biggest things that is a misconception that folks have. So one of the things that people will say is, oh, I have this form that I embedded on my site, and it's not possible to tie PHI data back to, this insecure site. You just want to be really careful that the data itself that you have as PHI is not linkable and accessible in an insecure way to a list of people. A lot of the things that we see that are kind of HIPAA violations or challenges that the government gets on to different providers about relate to lack of training internally, access to data that somebody shouldn't have. Think of, for an example, like a marketing company accessing a list of users who are part of a portal and then sending them emails that they don't share their PHI information, but they make it clear that the company actually knew they had some specific issue and they're marketing around that. Those are the kind of things that we see a lot of. We also see a lot of breaches of the hosting environment, and that hosting environment needs to be secure wherever you're storing that PHI information that you have. So whether you work with a third-party form company that is HIPAA compliant, or if you're doing something more complex that's maybe a mobile application or a HIPAA medical e-commerce site, for example, those type of scenarios, typically you're going to end up needing to get into the weeds around the actual PHI information and how it's secured, essentially. We recommend working with a specialist that can kind of unwind the details with you. But if you wanted to kind of get a summary of what typically is going to make sense, is going to be encrypting the data at rest. It's going to be multi-factor authentication for access to that PHI, logging of the access and any changes, being able to essentially have roles and restrict access to things to be as minimal as necessary. And these are some of the fundamentals. And again, there's a lot more to it depending on how sensitive your data is. But these are the kind of things that you would talk with a specialist about, depending on your situation.
Yeah, that sounds good. So we've talked a lot about, how do we know if HIPAA applies to you or anything like that? But let's talk about the next step in the checklist is determining if HIPAA is necessary, right? And we keep talking about PHI and storing the data and things like that. So let's dive into that just a little bit. So let's take an online pharmacy. When does a pharmacy have to be HIPAA compliant? When does it not have to be HIPAA compliant? Well, if the pharmacy online is like CVS.com, and CVS.com, I can just go on, let's say more like right now, I go buy all my MSM and all my allergy meds and everything like that. I buy it on Amazon, right? Everybody just goes to Amazon and they order everything. Does Amazon have to be HIPAA compliant? No, because Ron just ordering some allergy pills doesn't mean that he's got allergies necessarily. He could be ordering that for his daughter. I could be ordering it for my wife. I could be ordering anything. And my account.
It's over the counter, basically.
Yeah, it's over the counter, right? So if there was a prescription for something, then that is something that I had to go to a doctor, and that is now protected information. So the online pharmacy, where it then bridges the gap from just buying vitamins off of Amazon.com to going and buying whatever it is, my tramadol pain medication after surgery at Walgreens.com. That changes completely, right? That's different information. And now we've determined that that is necessary. The other thing too, here in the first bullet, one of the things that we specialize in with our Connect platform are integrations, right? We're constantly integrating these portals to the hospitals, EMR, EHRs, so that we can have this type of information. So a patient could log into the portal and see their lab results. The patient could log in and fill out a form, and it could go up to the doctor and provide those onboarding forms back to the doctor. Most of the doctors now that I go see, I'm filling out the forms online, right? So I'm in a portal and I'm filling out personal health information in a form that is then being sent either through integration to that portal or it's being sent through the integration into their EMR. So go ahead and cover what it doesn't cover. Go ahead and extend on if there's anything else besides that, right? But if there's something else that you want to cover, go ahead and cover that as well.
Yeah, I think those are some great examples that you shared there, because over the counter versus with a prescription is kind of odd if you think about it. But that's really one of the big takeaways that we would have for folks with the laws is they're laws, and they are very specific. And when you get down into the brass tacks, there are nuances for pretty much any aspect of it. There are some major black and white, just very clear distinctions. And some of the biggest ones you hit on, it's essentially, any information that somebody is inputting that's related to their medical history, a prescription, any kind of general, information related to insurance, these kind of things, those are, as a kind of general rule, those are going to be HIPAA data. And whenever they are attached to somebody's name or their email or something that is called identifiable, in other words, if you were to see it and have it tied to some medical information, like we just explained, you would probably be able to associate, hey, this person has this issue. And you could, look up their phone number or look up their address or look up their name or email and figure out that that person has that PHI. And whenever those pieces of information are associated, that becomes essentially a very sensitive set of data, right? And so there are situations, though, where you're not going to be, you're not going to be responsible for this. Over the counter is such a great example. There are many others that are like that. And some of them are edge cases related to things like mobile applications that only transiently have the information, so they don't actually store it. A great example that's pretty recent is video calls for telehealth, and the fact that the information is never stored on many of the devices. For example, in theory, FaceTime, and I don't know the mechanics behind this, but there is literally a OCR written notification about this that says that FaceTime, so just using Apple FaceTime, is not, you don't have to have a BAA, you don't have to follow certain HIPAA guidelines essentially to do FaceTime. But if you want to do a Zoom call that is recorded, well, that is HIPAA data. And so you have to take that recording and treat it as sensitive HIPAA data. So one of the key factors here is whether or not the data is stored or is essentially transient or not. And so I think that's a great thing for you to think about if you're trying to distinguish this, are you covered by HIPAA or not? Another thing that I see quite often is a lot of folks tell themselves that what they're dealing with is not HIPAA data, it's not PHI, and it absolutely is. And it's kind of scary because, some of the folks that we interact with, they have these production environments with tons of PHI data that is not secured. And the biggest thing that I would leave you with is the government, in my interpretation, and I've looked at all kinds of notices and fines and basically enforcement of the rules. And typically the government has given a heads up and requested that someone comply with HIPAA, as opposed to just immediately enforcing the rules aggressively. They want people to comply with HIPAA. And even though it is somewhat complex, and when you boil it down, it's really more of a culture change and more of a constant thing that you're going to be working on, just like security and just like any other aspect of your business. It's It's something that you want to just put into your culture and into your organization and have it as a constant thought. But again, there are some scenarios essentially where it's transient data, it's over the counter, it doesn't require a caregiver type of interaction to get at the data. And some circumstances with certain data related to other aspects of what some might consider PHI isn't actually PHI. So we recommend that you dig into this. Unfortunately, it is the reality that in most cases, the data is going to end up being PHI, and you should just be overly cautious as opposed to being, too cavalier with it.
Yeah. Yeah. And it's funny how it applies, even though it's the exact same data, HIPAA can apply completely differently. So, for example, if I went to a chiropractor who was old school, who still had all paper everything, had his own x-ray machine. So I went in for the first time. He took x-rays on my back. He put me in a treatment, and everything were handwritten notes, and he had a file in his office. That's PHI information. However, the application of HIPAA is completely different because that data, unless it is entered into an electronic digital format where it could be transferred across the internet and shared, that falls under a completely different set of rules. And the way HIPAA applies to it is even different. And so let's talk basically about the HIPAA basics when it comes to a website. So obviously, I'll just cover bullet number one. It's not that technical, right? And the last 15 minutes, we've pretty much talked about it. We want to know which rules and which safeguards apply to PHI. And then obviously we have to apply those basically to the website. I mean, that's kind of the whole basics of HIPAA for the website. The second one is one that I've seen, Chris, I've seen some of the videos that you've done. And this is where companies have a tendency to fall down. And basically what will happen is they're like, oh, well, we went to a vendor and we had them build us a HIPAA compliant portal and we're using that portal, so we're all covered. But where I've seen you say in some of your videos when you've read some of these breaches is limiting the sharing of the data. It's almost like the bank president has all the keys, right, to everything, but all the tellers don't. Why don't they? Well, because we don't want the tellers to have access to everything that a bank president would, right? We don't want that kind of risk. And that's the same thing that needs to happen within a practice. Every single person, the receptionist up front, if they're not a nurse, does that receptionist need the same access to all of the PHI data and potentially have the capability of disseminating and sharing and violating HIPAA by emailing data out that's in a non-HIPAA compliant format as the doctor or the nurses should have, right? So go ahead and dive into some of these other bullets and where it gets a little more technical on things like that.
Yeah, that's a great example with the bank president and the tellers, because fundamentally, if you think about the rules and the way that they're written, and the goal here is for us to give you a summary, but point back to those as the final source of truth. Really, they boil down to essentially limiting access. Think of the word privacy, limiting access to what anyone within the organization internally can see to what they need to know. Should be on a need to know basis. And then once they no longer need to know, they do not have access to the data either. So that's kind of another aspect of this that is important. So if somebody is providing care and then they stop providing care, they should have access while they're providing care, and then no longer, after a certain time period, they should no longer have access to that patient's records, after they aren't providing direct care. And there needs to be a log of when they're accessing the records so that we can see who accessed what when. And so team members should be trained so they know, hey, this is actually the law. Like, this is how the law was written to protect our patients. This is a different industry than other industries. And there are laws that regulate and govern how we treat and handle this data. So the biggest thing in general is providing consistent training. It works really well to do a once a month, 1 hour training, or provide essentially a set of training videos and resources. Again, a lot of the vendors that we work with, they specialize in this internal training and certification that your team can go through. It probably makes sense, in addition to your data compliance officer, your data security officer that you're going to assign as part of HIPAA. It makes a lot of sense to also have several roles depending on the size of your company. This should expand naturally, but several roles that are responsible for training and providing just ongoing culture shift around this idea of being secure and having privacy for this PHI data. And fundamentally, that is the biggest kind of sea change that most organizations have to go through, is that they respect the privacy and they understand what that means. So it's I guess in general, don't access people's information, even if you're curious. We see that with a lot of HIPAA aspects. And then the other big thing in general is really making sure that it is, it's a process that your organization is rigorously going through. Because if you look at security in general, one of the biggest loopholes that most kind of security hacks occur from is a human being who is the weakest link in the security chain. And it's generally very much the same with HIPAA. It's going to be a human being who's interacting with the data, quite often that they're just mishandling it. Maybe they're doing data work or reporting and they save a local copy of all the data. Well, that's all of that HIPAA data is now locally saved to somebody's machine. And then if their machine gets hacked, there goes all of that PHI and privacy. So you want to have standards in place for how you handle the data. One of the best ways to see it is just see it as being very, very sensitive and train around that within your organization. What does this mean? Go through scenarios. If you're trying to provide this report for our data, is it okay to save the data locally? No, it's not. Why not? What could happen? Oh, I see. And then really talking about, like, if you're just curious about this patient, is it okay to just go look at their data? No, it's not. And did you guys know that as part of HIPAA, we're actually logging everything? Like, we have to log access to everything and who accesses what when. It's not something that we're doing to spy on you. It's part of HIPAA. And so we just want to make sure that you guys know about this and you kind of get this culture going within the organization that everyone really respects that HIPAA data.
Yeah, you mentioned a second ago, I love the term handling the data. And you gave the example earlier, but it was really vague and it was really quick. And I don't think that people really got it. But one of the videos you did a bit ago about one of the breaches, and you'll have to correct me because I'm sure I have the facts incorrect, but there was a doctor or a dentist or somebody that did a very specific type of treatment. And he went to a marketing company and only gave the email addresses. No information about diagnoses or anything, but he gave some email addresses to a marketing company, but it was to market about a very specific medical product, which then one could infer, it's like give it to people who, hey, here's a list of 100 men to go market Viagra to. Well, one could easily infer that they're going to the doctor because of ED, right?
Right.
And that just violated. And that's what he did. He turned around and he gave out thousands of names to a marketing company to go market a very specific treatment, which, even though all he gave them was the email addresses, it violated HIPAA because the treatment that they were marketing definitely inferred that they had the diagnosis that what they were marketing, right?
That's right.
And so the handling of data, even if you don't feel like you're violating the sharing of HIPAA data, can definitely apply there. And it's almost like when you were talking about access to the data or not, X-ray technicians is a great one, right? I break my arm, I go to the hospital, the radiologist takes the X-ray, they read the X-ray, then they have to give it back to the doctor, and then the doctor delivers it to me. I was always frustrated. Why can't the radiologist just tell me they read it? Why do I have to wait a week till I see the doctor, right? Well, it's because the radiologist doesn't have access to my records. They do the X-ray, they read the X-ray, they upload their notes, and it's gone. They don't have access to anything else, right? And so it's very protected and it's very pocketized. Everything's in these little pockets for following those HIPAA guidelines and the handling of that data. So moving on, we're going to go into step 5 in the checklist, which is to research and follow the HIPAA rules. I know that seems like just a pretty basic statement, but we want to know about the different rules that there are. There's a whole bunch of different rules. So if you want to go through and kind of dive into whether you want to talk about, privacy or engage the audience about how you research the rules and how you follow the rules, right? Because the word compliance is such a nebulous and a vague term, right? And everybody keeps talking about HIPAA compliance and what the heck that is. And then they talk about privacy rules, then they talk about guidelines, and they use so many different words that it's really truly hard to understand what am I looking for and what am I following, right?
Yeah. The source of truth is the government website and the actual regulations. The HHS Gov website is really, it's a very excellent resource. It's not perfect, I'm sure, but it has some great specific details that walk you through a summary of the privacy and security rules and some of the specific things that you need to actually do around those. So, specific examples, specific scenarios, and what the rules mean you need to do, and supporting software and guidance and notifications from the OCR about some of the enforcement that's happening and giving you a heads up so that you can avoid that essentially. So, now to summarize some of what those key aspects are to be looking for, of course, understanding what the rules are in general by reading through them. And that may seem like you said, Ron, a little bit of an oversimplification, but it actually isn't. Most people generally, they just never read the rules. And we have some great videos that go over these rules in a summary format. And you can even 1.5x or 2x the speed if you want and get a lot of this information really quickly, where we're going through it in detail in a couple of videos. So highly encourage you to take a look at those if you want to get a crash course on the actual rules. And then the next thing is asking yourself this question as you're going through it. What are the takeaways? What do I need to do? Now, to give you a little bit of a shortcut here, one of the things that we also recommend in this series, and we talked about this earlier in some of the earlier steps, is working with a company like Accountable HQ, for example, or a similar firm that does this compliance type of work. And they will give you checklists and actually walk you through similar training to what I just referred to on YouTube that we provided. But the big deal here is going to be that you need to have essentially a role within your organization or multiple roles that are focusing on adhering to this, and that you adhere to the privacy and security rules within your team. So this means making sure that you're tracking information access, you're tracking who's viewed information that's PHI, keep track of partners that you're sending this to and what you're sending, being able to understand really in general what's transferred and anything that's changed. And then, of course, what your processes are to keep up with security, and being able to comply with requests for information from customers, from patients who are actually requesting their PHI data be removed or that it be shared with them for interoperability, these kind of things. But the summary is HHS Gov's website is awesome at sharing this. And then if you want to get a shortcut, you can watch our YouTube series. It's just a couple of videos that go over the actual site. We highlight the key aspects of it and literally walk you through it step by step. It's pretty concise and really will give you the meat of this step.
Yeah, kind of covers the who, what, where, when, and why, right? Really summarizes it well.
Exactly.
All right, so let's go on to step 6. And step 6 talks about encrypting the forms. This is one of the ways that I call it HIPAA through obfuscation, right? We've got some clients that'll come that have websites they've had for 5-10 years that are not HIPAA compliant, that were just medical marketing information about their firm, their dentist practice, their doctor's office, things like that. And then they come back and ask us, hey, can we go ahead and add our onboarding forms, right? So when we get in there, we're like, yes, but when you add the onboarding forms, if anything in the forms has, insurance information about their care, their health, the medications they're on, or anything, that's all PHI data. And those forms then have to be HIPAA compliant, and you have to apply the rules. So you've only got really one of two options there. One is the HIPAA through obfuscation that I said, which is you work around HIPAA. Now, what do I mean by that? Well, that means you leave the site non-HIPAA compliant, You put your SSL certificate on, so everything on the screen that a user is viewing is encrypted. And then when you put the form in, you have to use either a third-party tool like a Jot Forms, something that's an online SaaS base. It's already HIPAA compliant, and you're just embedding the form on the website. Or where we've done some old WordPress sites, we'll use something like Gravity Forms, and we'll go into the form that when they hit the submit button, it can't write to the database and store the data in a non-HIPAA database. So what it'll do is it'll forward the form data to a HIPAA compliant mailbox, right? And then that allows them to have HIPAA compliant onboarding forms on a non HIPAA compliant website. The only other option is you have to go back, and we've done this for other clients. We'll start with a new encrypted database, a new HIPAA hosting environment, and then we'll migrate the website over. And so now the website can become, kind of, as we used to say, bring into the 21st century, right? Get it up to speed, get it HIPAA compliant. Is there anything else you want to talk about? Because I know HIPAA is not just about just the forms. It's also about, the data and the logs and things like that. But anything else specifically about the forms you wanted to talk about?
Yeah, I think the biggest thing here, and thanks, Ron, is there are different parts of the spectrum that you might exist on with where your needs are with the PHI data. If you're needing to persist the PHI data in the application you're working in, then doing a third party hosted iframe type of format that Ron's talking about, or just transiently passing the data, never storing it or persisting it, that model, which is typically going to be substantially less expensive, that's not going to be applicable if you have to do things and store that data within the application you're working in. So that's really the key distinction there. And then fundamentally, the concept here is that we are still HIPAA compliant. We're just scoping down what is HIPAA compliant. We're literally just taking the PHI, putting it into a third party HIPAA compliant form of some kind. The other thing that's interesting about this, Ron, is you don't have to just work with a third party that does HIPAA forms. If you have a development team or you're doing development internally, this is a nice way to, as you said earlier, obfuscate or really make it more opaque and less clear to someone who might be attempting to get at that data. You can have your team make any HIPAA data in an iframe type of format or an embedded form that is just very much a small part and has a very tiny footprint on your application. And that's another little tip to keep the footprint of the security kind of footprint smaller. So, but yeah, the big thing is that you are complying with the security rule of HIPAA here because you're saving the data to a HIPAA compliant hosting provider.
Yeah. And one more comment. As you were talking about that, I remembered one of the things that we've done before. I didn't sell this, but you did it. And that's what just reminded me watching you talk about it. The two different ways, the one that I mentioned is one, like we went into Gravity Forms and hacked it, if you will. We modified the code so that it didn't store the data in the local database, but forwarded the submitted form data to a HIPAA compliant mailbox. That was one way to do it. The other way to do it that I've seen Chris and the development team do is that they will use a third party, what do you call it, Chris? You call it a vault, a tokenizing vault. Do you want to explain the ability? It's almost like PCI tokenization of credit card numbers, but you can actually do it with data, right?
Yeah, that's right. The idea is, in theory, it is to de-identify the data. Now, de-identification is a rabbit hole that if you look at the security rule on the HIPAA site, it's really specific, and it's basically implying that most people think that they've de-identified their HIPAA data, but they actually haven't. Tokenization is an advanced way of encrypting the data. And all it is, it's really simple. We're sending the PHI data to a secure location that is basically very, very, very challenging. Think like a Fort Knox level of security. It's very challenging to penetrate. So this is really helpful. We're sending the data there, and then they're just giving us a key or a token, which is like a thumbprint, a fingerprint, if you will, to be able to get at that data later. But this is storing the data, that PHI data, in a secure location. So it's a really smart way to at least reduce the security risk, like you're saying, Ron. And these are the kind of things that you want to at least be thinking about and looking at. And again, it is a spectrum here. So think about what the risk level is, how sensitive the data is that you're dealing with. And this is literally what the security rule says on the HIPAA website. You can read it for yourself and, of course, interpret directly what you think. But it's saying there is a spectrum for different healthcare organizations because some of the data is more sensitive or it can be more prone to being, lost, that kind of a thing.
Sounds good. Thanks for that. Um, So same thing with the that one. Step six was talking about the HIPAA compliant web forms. Now we're talking about the content forms. Don't know that we need to talk a lot about this, but same kind of thing. The contact forms would be when patients or anybody are signing up. If it's just like, hey, it's Ron, here's my phone number, please give me a call. That's one thing. But if it's, hey, it's Ron, I'm having shoulder pain, or my diabetes medication doesn't seem to be working as well, and you're allowing for things like that where PHI information can be inserted into the form, then your contact forms also, because this is one that kind of slips through the cracks, right? Everybody thinks about the onboarding forms having to be HIPAA compliant, but they forget about the simple contact forms. But most of the contact forms that we see in the doctor patient portals and in the mobile apps that we do for medical usually have the ability to look for a doctor specific to, oh, I'm having shoulder pain, so I want to look for a shoulder doctor or an orthopedic surgeon. And it allows you to start adding in specific information about your health concern and why you're wanting to schedule an appointment with the doctor, which ultimately is PHI data. So you'll want to make sure that when you're looking at your contact forms, is it a typical one we see at every single company like Lowe's, right? I can go put in my name and phone number and please give me a call and that's it. Or is there an open text field where I can say, please give me a phone number. I'm looking for a prescription for diabetes or whatever it is, that then crosses that line into PHI. So you'll want to make sure on the contact forms, as Chris said a second ago, across the spectrum, what kind of risk is your contact form exposing? Okay. Moving into the next one. Let's go ahead, and I'm going to turn this one over to you because you're the server guy for sure. The word I always hear you use is hardening, right? Harden the environment or hardening the server. So let's talk about a web server. And again, Chris will probably say, you can work with a third party like us, or sometimes you can just go up to a vendor like Azure and AWS, and all of them offer these HIPAA environments as well. But even if Clarity is doing a website for a client, and we're going to put them up on Azure or AWS or Liquid Web or someplace that offers HIPAA hosting, Clarity still has to spec the server, right? Because the applications take different numbers of processors, different number of data. How much data are we storing? Are we storing logs, or are we just transiently, as you said, passing the data through? Things like that. So go ahead and dive into what do you guys do over on the infrastructure and security team when you're defining what these environments or maybe the server should look like?
Absolutely. So I would say one of the best things to think about whenever you're looking at HIPAA compliant servers and hosting is a phrase that is really helpful, which is just a blueprint. Having a blueprint is a huge factor in success. And you can think of this as a checklist. One of the things that's really interesting about my background, and Ron, you know this, but some of the viewers may not, is whenever I was 17, I got my private pilot's license. And I remember sitting there thinking, I'm a 17-year-old kid. I just got my driver's license like a few weeks before, you know, and I'm literally flying an airplane over a crowded DFW Metroplex airspace. And I have a checklist. Like I remember thinking, okay, this is the checklist that all the other pilots use. And I know I can follow this checklist and it'll work. Well, it's the same exact thing. If you feel like a 17-year-old who's just getting your pilot's license and you're flying around a crowded airspace, that's what HIPAA is for a lot of people. These blueprints are made by the government and by other organizations that really their intention is to make it very simple, and it's not necessarily easy, but very simple to be able to follow HIPAA security rules and best practices. And that's really, if you want to boil down the security rule, it boils down, and this isn't literally true, it just generally speaking, it boils down to follow industry best practices for securing your data and having a secure environment. And so these blueprints are really a step by step to do that. Now, one of the things that I'll point out is for example, the blueprints from NIST and from the high tech HIPAA blueprint that you can use. These are typically available in a step by step process where a lot of these steps are automated in platforms like Azure, in AWS, for example, as well. One of the really cool things about some of these hosting providers is they will do a lot of the actual BAA and ownership of the HIPAA side of things through a BAA that they will sign with you. And they'll take ownership of the infrastructure. And basically, there's a concept of infrastructure as a service. If you haven't heard of it, that's really what they're talking about when they say infrastructure is your web servers, for example. And so the point is that you can get a lot of these capabilities and these checklists, these blueprints, and have them mostly already done. You can work with a service provider like Clarity, and we can go in and we can literally just go through these blueprints, check everything off, make sure it's compliant with that checklist, and then provide you with a report that goes into your HIPAA compliance, logbook that you're keeping. Really, really nice way to go. Now, a couple of the other things that we'll point out about this, just following a blueprint doesn't guarantee that you've maintained your altitude and you have fuel in the tank while you're flying your plane, if you want to use that analogy still. So we do need to constantly be vigilant and using tools to pen test and validate, make sure that we're updating and patching. And these are some details that we go into as you'll see with a lot of these steps in some of our other videos. But the big takeaway here is use a blueprint. It's like a checklist, and it really is a great way for you to assure yourself that you can rest well at night. I mean, that's really what this whole discussion boils down to, is us trying to share with you what we've experienced so you can rest well at night.
Yeah, it's true. I love your analogy about flying the plane. It's just so applicable, isn't it? The other thing, too, as Chris mentioned, that checklist really applies to us helping to set up and get your project set up and HIPAA compliant from the start. And then obviously when we hand it off, the rest of your business that doesn't really apply to the website has to become HIPAA compliant as well. And that's where Chris just mentioned it a few minutes ago about Accountable HQ. We're an Accountable HQ partner. It's a great tool. It's relatively inexpensive. I mean, I don't remember the exact price.
It's $500 a month. Yeah, $499 a month. And the prices will vary with different tools, but the main takeaway is, like you're saying, Ron, relative to the peace of mind that you get for using some of these tools. And a lot of the tools, they're compliance for your entire organization, not just for the security rule and not just for your applications, your software applications, but for your entire organization. So you want to evaluate the different options and the cost benefit. You don't have to pay for tools, just maybe more beneficial to spend a little bit of money and save a lot of time and have that assurance of that third party that's backing you up.
Yeah. One of the things that Accountable does is they will run the periodic compliancy tests and come back and give you a report and let you know where you are at. Some of the things you can fix internally because it has to do with the practices within the organization. Some of the things may have to do with the applications or websites, and then you can hand them off to your vendor like Clarity, and then we can go in and address those. So anyway, really important. And I know Chris on some of the previous steps talked about the different free tools that are also available on the HHS Gov site. So the next one talks about the SSL certificate. Now, I've heard things like, alpha certificate, wildcard certificates, and there's all kinds of different certificates. There's domain level certificates and there's free certificates. The $69 one, that's one we do a lot on the marketing websites. And then there's the $200 a year ones, and then the wildcards that are a few thousand. So I don't technically know the difference between these. I understand the difference between a domain level, right, and an org level. But why don't you go ahead and tell the audience the difference between the certificates and which we recommend for these types of projects?
Yeah, absolutely. So I think the biggest thing here is making sure that data is encrypted, not just at rest, but in transit as well. And that's really the takeaway here. So just if you get nothing else from this step, You want to make sure that you're validating that everything is SSL essentially across the board. There really is no reason nowadays where there should be any data that's sent that isn't sent over SSL, period. And now, with that said, the distinction that you're making, Ron, I think is about different subdomains and what type of SSL certificate to purchase, as well as the different type of verification of the organization during the certificate issuance process. And we have some really nice detailed guides that we can provide in the description that you can take a look at. So feel free to take a look at the description to get some of that information in detail. But the summary is there is a spectrum of level of verification of your ownership of the domain, and then your actual validation of being an organization, and then fully validating your organization is registered with a different jurisdiction essentially that can be verified, and some of the different documents that would verify that you're a real company. And so if you consider that as a consumer or just generally following best practices within the security side of things, does it make sense for you to be on the more secure side of that spectrum? Generally, if the data that you're dealing with is very secure, then you want to make it more challenging for someone else to replicate your SSL certificate. But generally speaking, the big takeaway here again is you want everything to be encrypted in transit and at rest. That's just generally something you're going to want to do. And then specifically, whenever you're dealing with different applications, for example, we were talking about embedding HIPAA forms and doing that within your own application. Well, you may have a subdomain called forms.abccompany.com, or it might be something like api.xyzhealthcare.com. That would be a subdomain, that API dot or forms dot in the URL. So you would just want to have SSL certificates for all of those as well. So not just your primary domain, but any subdomain, any traffic needs to be encrypted. Back over to you, Ron.
All right. Real quick on the screen here, I'm going to show you two different SSL certificates. We were talking about the free certificates that are not domain level verified. So up in this URL here, you can see the lock to the left. If I click on the lock, it's going to pop up and say that it's a valid certificate. So this is a free certificate, and you can see that this certificate doesn't say who the certificate was issued to. It was just a website went, got a free certificate. Now, if I go over to the Clarity website, you can see we've got the same lock, but if I click on that, you can actually see that it was issued to Clarity Ventures. Now, that is when we say the organization or domain level certificates, where when we went to apply for the SSL, they actually validated the actual Clarity Ventures organization and issued the certificate to that verified organization. And that's a domain level certificate. So obviously, if someone's going in and they're going to do business with us and they're going to put their social security number and their health information, they may want to click on that certificate and ensure that that secure site is registered to that specific organization. It's just an extra level of trust. So just real quickly, that's how you can tell the different level of certificate that's been issued. So let's talk about choosing the HIPAA compliant solution. A lot of times, I would say, 99 times out of 100, except up now, I guess we've got our new HIPAA e-commerce off the shelf, but 99 times out of 100 for the last 10 years that I've been here, every one of our HIPAA compliant solutions are we build it, right? They come to us, they have a need. It's a doctor patient portal, it's a mobile app, it's a combination of both. We've done applications that got FDA approval to be used and patented in the operating room. I mean, we're building everything. So when people come to us, it's not like, do we have an off-the-shelf HIPAA compliant solution? It's they're usually looking to have one built, or they're working on an application. We have quite a few partners that are building applications, but they don't know how to make and ensure that they're HIPAA compliant, so they'll come to us for that. Now, we do finally have our HIPAA e-commerce solution off the shelf, and so that is one now that we can offer you. But I want you to talk a little bit about choosing the HIPAA compliant solution, especially if they're not going to have one built, right?
Yeah, great question. And this is actually for those who have seen some of the webinars that Ron and I put on. It's really interesting, but the way that Ron and I met was Ron was originally a client with Clarity about 13 years ago. And we worked together for 2.5 years as Ron being my boss and the client. And I loved it. And anyway, the long story short is one of the things that we did was we collaborated on an e-commerce product that was off the shelf. And this was really the genesis, among other similar projects at that time, for us building our own at Clarity, our own e-commerce platform. And I think a lot, Ron, of what attracted you to the vision of Clarity was this idea that we would be delivering an e-commerce platform and an overall capability for some of the B2B and B2C niches that we focus on. In this case, HIPAA, not just e-commerce, but HIPAA portals and HIPAA application development, and being able to deliver a product that has a lot of features that are available that most companies and organizations are going to need as a baseline, but still retaining the ability to be fully configurable and customizable.
Mm-hmm.
And one of the things that we experienced, Ron and I did whenever we were first working together, where Ron was a client and Clarity was providing value and service to Ron, is we made the mistake of purchasing a very expensive off the shelf platform. And essentially, the phrase that we like to use is we painted ourselves into a corner. And we ended up in that corner, and basically we had a very expensive device or application that couldn't do everything it needed to do, and it had to essentially be thrown away. So all of that capital was wasted. And how many times does that happen, Ron? I mean, how many times do we hear about that scenario?
All the time. It becomes shelfware, right? That's the the term everybody calls it, shelfware. Yeah. Yeah, no, it's true. Matter of fact, every sale that I do to government entities, one of the things that Clarity offers is I don't force people to buy the annual maintenance, right? Because a lot of times they'll build a website and it'll run and they'll just kind of maintain it. And then in 4 years, they'll come back and go, okay, time to refresh the site. Let's restyle, let's update, and they every 4 years they come back. So one of the things that we offer is we offer them to just do standard maintenance, but we don't force them to pay for the license to get all the new versions every time it comes out if they don't want to. But with the government, one of the things that they say that because this is grant money, because it's public tax money, we legally cannot have anything become shelfware. We have to buy maintenance. We always have to have access to the latest and greatest to ensure that we don't, as you just said, paint ourselves into the corner, and we always can keep the software up and functional and working, right? They don't have the luxury of potentially waiting 4 years and then all of a sudden the software just not working and doesn't do what they need to do anymore, right? So when you look at the solutions, make sure that you've got options, right? You want to ensure that not only can you get your HIPAA compliant solution, but that it can service your needs today and not become expensive shelfware like Chris and I learned back in the day. So now let's talk about the hosting. And I know we briefly, when we talked about hardening the server a few minutes ago, we talked briefly about Azure and AWS. And I know for different things, we have our favorites, right? Go ahead and talk a little bit about some of our favorites, and or if a client wants to host themselves, some of the things that you would recommend when considering hosting.
Absolutely. Thanks, Ron. And I would say the big thing here is that it needs to be compliant with the security and privacy rule, which is the whole point of talking about this. So great, Chris. Who are the companies that tend to do that? Well, they tend to be companies that encrypt the data at rest. In particular, one of the key risk areas that we see a lot of is the database itself. So you want to check not just the files and the application logs and things like that. Those are really important to check about, but also check on, but also the database and any kind of persistence layer. So you may also have caching of some kind. And so any of these layers, they really need to encrypt the data at rest and in transit. And so again, one of the great ways to validate this is, are they following one of the HIPAA blueprints? Are they following those checklists? And the other thing that really puts somebody's money where their mouth is when it comes to HIPAA is requesting that they sign a BAA. So if the hosting company is willing to sign a BAA that shows that they're taking ownership of certain areas of the hosting and what they're doing, Well, that's pretty cut and dry that, they're legally committing to doing that and being compliant with HIPAA in that regard too. So ideally you want to line all of these things up. You never want to be negligent about checking and verifying that the security rule is enforced. And so ultimately, the baseline here is that the data is encrypted across all of the different infrastructure. And again, is going to include any type of caching and that type of thing as well. So, pretty detailed step, but that's what it boils down to.
So let me ask a simple question. You mentioned the caching. I know one of the things we do on a lot of sites when clients don't want to spend a ton of money is they'll go spend, $20 a month for Cloudflare, Encapsula, something like that. How does that kind of pre-caching, server-side caching apply to a HIPAA server? Let's say we did Azure and it's a HIPAA compliant environment, but then we want to improve our performance. So we go turn on Cloudflare. How does that affect us?
It depends on how the data is stored. Generally speaking, you won't end up with caching in a CDN from data that's PHI, because the way that the software is architected, ideally, is that whoever is writing it is going to be preserving any PHI and reducing that footprint of where it's exposed. For it to get into a CDN like a Cloudflare, it would basically need to be persisted into like a JavaScript file or a CSS file or some kind of a static file generally. And although they have other caching mechanisms with Cloudflare, you essentially just want to be careful, and with any CDN in general, be careful about just considering that you're not literally leaving the front door unlocked while you have Fort Knox. Make sure you lock the front door too, which
Yeah,
caching is a really, really easy entryway if you're not careful.
excellent. Thanks for that.
Mhm.
So the last one, obviously, you're holding a lot of PHI data, and this PHI data can be historical data about a patient's care, right? I know I moved to Texas 16 years ago, and I've gone to the same doctor. And I love going to him because every time I go in, if there's any problem or any blip on a blood work at all, he literally opens up his chart and he goes back 15 years and he says, "Oh, okay, well, it looks like we're plus or minus 2 or 3%. I think we're okay." He goes, "I would have thought that was off, but this is just normal for you, right?" And I love the fact that every time I go in, he knows everything about me for more than 15 years, right? But if he lost that data and it's gone, to try to go back and start and find that is just impossible, right? So, one of the most important things, especially for providers that want to provide good care, is to ensure that they have all of their data. And so, this includes things now. I don't know if you want to, when you talk about this here in a second, and I turn it over to you, I don't know if you want to talk about also the new GDPR equivalent where people are now have the ability to call a doctor's office and say, "I want you to forget about me." Well, what does that mean? Does that mean forget about my personal contact information so you don't reach out to me and I'm no longer a patient, but you still keep all the information about the prescriptions and the care that you gave me in case a lawsuit's filed 3 years from now that they claim you botched it and you have to be able to go back and defend yourself and see all the x-rays and the tests and the blood work and everything that you did, right? So when you talk about backing up the data, if you want to mention that as well, that's something I don't know the answer to. So it's actually a real question I'm asking you. So go ahead and talk about that.
Yeah, yeah, absolutely. It's really interesting with the backups of data because it's a double-edged sword, and it's really a fine line that you have to dance on while not getting exposed to either extreme. And ultimately, for a healthcare provider, it is a matter of providing value to the customer and making sure that there is that disaster recovery aspect and high availability, etc. But by its nature, taking a lot of backups and having a lot of redundancy is creating a bigger footprint and more exposure, or at least more surface area for risk, right? So you're making these backups. Are those secure? Could those get penetrated and attacked? And unfortunately, that's just the nature of this scenario, is that you really have to optimize around these relatively challenging constraints. And that's part of the industry. And ultimately, it does make a lot of sense, and it's fundamentally probably just a requirement with any business that you have great backups. If you don't, there can be catastrophic downsides that are more substantial in many ways than, not being compliant with HIPAA. Um, and then ultimately, in addition to having all of those backups, like HIPAA, you don't want to not be compliant with HIPAA either. So how do you do this in a secure way? And one of the key pieces of this is the privacy rule that you mentioned, Ron, and people being able to request that their PHI data be removed. And that's something they can request, that their PHI be removed from your system. And that, I would say, would be a key distinction. So that's really the detail there that I would use to have as a litmus for, does this pass muster? Can we keep this data but not this data? The idea is that you want it to be de-identified if someone requests that you purge their information from your system. And you need a mechanical way to be able to do that. Now, I think that's pretty challenging whenever you get into a lot of robust backups and detailed backups. And there is some just realistic pragmatism here with what is and isn't required. And again, it lives on a spectrum with HIPAA. And I won't pretend to adjudicate and be a legal specialist here. So you're going to want to consult with someone who is a qualified legal expert and understands your situation. But generally speaking, I think that the best practice is you need to be in a position where, with the active data set, you can remove someone's data, and in future backups, it's not going to be retained. But there may be a legal counsel out there that would say their interpretation is that all the previous backup sets, you need to purge their data from that too. But this should just be PHI. I would generally say there really is a tone of being very pragmatic and realistic within the HIPAA guidelines. And you can see that with a lot of the notifications and et cetera. So the other piece is then, making sure that your data, the backups in particular, are secure. And a lot of this is pretty simple stuff. But one of the things that I'll point out is there's nuance you can go into with making sure the backups are secure, but making sure that you have a cadence of checking these things and validating them is probably the most important thing. You're going to have different team members you work with. You're going to have different vendors, and they're going to be handing things off. This is really where you can get into a lot of trouble. No one's going to care about it as much as you do. So you need to at least have oversight and validation. Inspect what you expect is the old saying. And with backups, that's absolutely the case. Again, this is sort of a backdoor, leaving the back door unlocked here could also be pretty problematic, but it's pretty easy to go check and just ask a few questions. Some of the key questions are, is the backup data encrypted? Is it secure? So it's physically, non-trivial to get at. And is it encrypted? And, where are those keys kept so that if we need to unencrypt it, we can get at it, and that kind of a thing. So hopefully that's helpful for folks. Of course, as always, if you have any questions about any of these topics, not just the backups, but really any of these steps, please feel free to take a look at some of the other videos that we provide in the channel. There's some great resources here. And also, we welcome you to reach out to us. We have a complimentary discovery process. It's been extremely helpful for many clients that we work with in the long term, and for a lot more folks who don't end up being a great fit for working together, but we can still point them in the right direction. We welcome you to take advantage of that. And of course, Ron, I'll turn it over to you to wrap us up here.
All right. Sounds good. Well, thanks everyone for joining us today. It was a great start to jump into the checklist. We referenced a lot of different guidelines, rules, and resources today, and that's what the second webinar in this series is going to cover. We're going to actually start going through some of those resources and some of those guidelines in more depth. So look forward to in the next webinar series. And if you have any questions, again, visit us at clarity-ventures.com. Schedule a free consultation with me. I'll jump on a call. Would love to meet you guys. Don't forget to smash the like button and subscribe to the channel. Thanks again. Bye for now.
Thanks. Bye for now.